Hello everyone and welcome to a brand new segment of Insights by Dr. Azad Moopen. A very close friend of mine has developed cough from the past few days and his family has asked him to go and get himself tested. Now we have been hearing a lot about screening and testing centers coming up and tests being done regularly. Let's look into it today. Doctor, how successful can be COVID-19 testing? And what are the realities and fallacies of it? And also, is there any gold standard for diagnosis?
There are various tests available for COVID. And the main categories, if you look at, one is to test for the virus and the other one is to test for the antibodies. The one which tests for virus is the PCR test. PCR means polymerase chain reaction test. What this means is that you take out a part of the virus and then multiply it several times through some techniques, and then in that specimen look for the virus directly. That is the most specific test, but it takes time as well as it's not available in many places. The antibody test is much more easier. You are doing it, unlike in the earlier case where you are checking for the virus, it has to be from the nose or from the throat, from the body fluids. Whereas here you are looking at it from the blood. So the antibody test is being done from the blood, and this is much more easier to do, and it's also something which is very easily done and much less expensive. So in that situation, you can get a result, but you can't be sure. There can be false positive and false negative. It doesn't tell you that the person has the virus and the person is infective. So the most specific test is the virus test or the PCR test, and it is called RT-PCR because there is a reverse transcriptase which is being used for doing this test, which is little complicated. I don't want to go into that, but what you should understand is the PCR is the gold standard to tell definitely that it is positive. But even here, the issue is that it depends on the time when you're doing the test. Sometimes if you are doing it little early or late, there is a chance that even the PCR test may be negative. In that situation, you can't say that the person is not having COVID. So there are now certain new tests which are coming in, which is looking at the antigen, which is again part of the virus, which can be done much faster. It is not yet available everywhere, but once it is available, it is more specific like the PCR test, and it will also can be done in a large number of people. We are all expecting that this will be available soon, and that will be one among the best things to happen. Now, coming back to how do you interpret this? So you will have to definitely look at a way how to diagnose COVID in spite of a positive negative test, because many times you will find that even the PCR test is not positive. So you have to take a clinical decision depending on the symptoms of the patient, his clinical condition, as well as the X-ray and CT scan finding. Patients having pneumonia, you have a very particular or peculiar finding which will give you an indication that it could be COVID. So reading it along with the other tests, you will be able to come to a diagnosis. So we have to be careful while making a diagnosis, either positive or negative, and has to take the overall situation rather than depend on a single test, because there is no gold standard yet for diagnosis of COVID-19.
Although the fallacies remain, testing quarantine and isolation is the most effective way to break the chain.